Okay. My name's Tom McLean. I'm a pediatric oncologist here at Brenner Children's Hospital, which is part of Wake Forest University Health Sciences in Winston-Salem, North Carolina. And I'm a pediatric oncologist, and I'm delighted to be the recipient of an angel grant from the National Cancer Coalition. And just to give you a little background on what we do, we are a National Cancer Institute designated comprehensive cancer center. So we treat both children and adults with cancer. And so through that, we participate in NCI-sponsored trials. NCI stands for National Cancer Institute, which is the main federal branch of the National Institutes of Health, which sponsors and runs clinical trials. And I'm in the local principal investigator for the Children's Oncology Group, which is a group of oncologists that specifically does research for children with cancer. So you may or may not be aware, there's been a lot of research just in the past couple of years about the dangers of radiation exposure through medical imaging. So CAT scans, X-rays, nuclear medicine studies such as bone scans and other things like that actually expose patients to radiation.
Sure.
And we're just beginning to learn now that that radiation adds up over time and actually increases the risk of cancer years down the road.
Okay.
And that's particularly true for children. Basically, the more radiation you give, the worse it is, and the younger the patient, the worse it is. So that's motivated me to sort of think about how often we scan our patients. We routinely get images of their brain, either CAT scans or MRIs, to look to see if the tumor is growing back.
Okay.
And this particular project is looking at the utility of these, what I call off-therapy scans, to see how often does it pick up a recurrence, and if you pick up a recurrence on a routine off-therapy scan, does it really improve that patient's outcome? In other words, does it, the whole rationale for doing off-therapy scans is if you pick it up early, you might be able to cure that patient the second time around. But truthfully, there's very little evidence that that's the case. As opposed to, say, waiting until the patient had a headache or a neurological sign or symptom that might lead them to the doctor. Or if they're coming for a routine checkup, maybe the doctor might pick up something unusual about their neurological exam and send them for a CAT scan or an MRI to see if the cancer's come back. So my question is going to be looking at patients who had brain tumors and have had a recurrence of the brain tumor. Was that brain tumor picked up, or was the recurrence picked up by a routine test that was done when the patient had no symptoms, or was it done because the patient came in with a headache or neurological finding or some complaint that led them to come into the doctor? And look at those two groups to see, was there a difference in their survival? And the whole point of that is to look to see, is it necessary for us to do all these off-therapy scans? Because not only are we exposing these patients, well, if you do CT scans anyway, to radiation therapy, but you're exposing them to a lot of stress. These families get very anxious when the scans are due to come up. Expense, missed days of school, missed days of work. A lot of times they need to have an IV placed, and they're given IV contrast, which have risks. Sometimes the little ones, or even the big kids, or the adults for that matter, need sedation or anesthesia for MRI. All those things are risks or potential risks to the patients. And what I'd like to find out is it the information that we're gaining from those scans, the benefits worth the risks that we're putting the patients through?
Especially in the children.
Yes, especially in the children. Exactly. So I plan to do that by looking at a big database that we have here at the hospital. We've preliminarily identified about 2,000 patients, both pediatric and adult patients, who've had brain tumors. And many of those patients are doing well and having no problems. And we're going to look specifically at patients who have had a recurrence of their brain tumor. We're going to look at how that recurrence was picked up. Was it picked up on a routine off-therapy scan, or was it picked up because of a sign or symptom? Here we have those two groups. Including costs. I think we can look at cost as well as detriments of benefits and risks of doing those. And hopefully this will help provide some information to oncologists who take care of these patients and neurosurgeons and radiation oncologists as to how often and how frequently and if off-therapy scans are even indicated for certain patients.